So here we are in the suprapatellar pouch of your knee. Just going to clear a little bit of synovium away there. And we're looking around in the suprapatellar pouch, or upper pouch of your left knee on the 11th of March. We're looking at the lining of the joint. You can see the synovial fluid, those little fat globules there in the fluid, and the lining of the joint looks fairly normal there. Little bits of cartilage and a few bits floating around, which tell us that there is some trouble within the knee. As we turn the camera around, we're now looking up towards your head end and also towards the ceiling. So the top is there, that's my finger pressing from the top down, that's the top of the room. And we're coming back and we can see the articular surface on the back of the kneecap. And we can see here the shiny surface on the lateral side. And there in the centre is that kind of divot, that split. Doesn't look too bad actually. So, but there is certainly a little bit of damage right in the middle there, kind of divot in front of us. And then round over to the medial side looks fairly good. So the kneecap actually, a little bit of damage in there. And the groove in the thigh bone with which it articulates, there's that damage in the kneecap there. There's right in the centre of that groove of the thigh bone, a very shallow groove, and I think it's probably a pressure effect, and that's the kneecap there. And we'll probe that cartilage, and that goes right the way down into the knee and into the centre of the knee. So we'll just have a little look around now. I'm just going to focus the camera for us. So we are now looking round the lateral or outer side of the knee, and little fragments of cartilage around the place just here tell us they've come off somewhere inside the knee. Looking down into the lateral joint, and that looks fairly normal. And then right the way over the top, down into the inside of the knee, or the medial side, and that side also looks normal. So here we are inside the medial or inner side of the knee, looking at the femur above us here, and I can't find any evidence of that flap lesion on the medial femoral condyle. Normal looking femur here, looks all normal all the way around, and then right the way to the back as we flex up the knee, normal here. So I think that medial femur is indeed normal. Maybe little sort of soft area just here, but I don't think anyone's anything to speak of. The shin bone here underneath us looks normal, and the medial meniscus right the way to the back there is a normal medial meniscus as well. No evidence of tearing of that. So we can get right over the top and under the medial meniscus, and all the way around and right the way around to the front, a normal medial meniscus. So I can't see any evidence of a there, and that looks pretty good all the way around. So as we count the camera, also normal, and the right the way around there. So normal medial side of knee, and no evidence of that flap lesion or damage. Little tiny roughness, extra articular on the edge of the femur there, but I don't think anything to speak of. So normal medial femur. Can't see anything, just move, pull that out of the way. That looks normal to me. Perhaps a little rough, tiny little roughness just here, but really not much to speak of. Looking inside the centre of the knee here, we can see the anterior cruciate ligament. We can also see the posterior cruciate ligament just under here. Normal ligament there, so that's a normal straight ligament. And here we can see the lateral side, and there is a little bit of damage to the lateral femur just here, something that didn't show up on the scan. Do you see that little sort of split just along there, which looks like a sort of crevasse, I suppose. The anterior horn of the lateral meniscus coming around here, and that's normal. And a little bit of damage on the top of the shin bone there, so interestingly it's the lateral side of the knee. It looks like it might have some trouble, and we'll have a little look at that. So here we are now on the lateral, the outer side of the knee, and the lateral meniscus itself is normal right the way to the back. I'll take a picture there. So that we've probed all the way, right the way around here, and that's normal. But the lateral tibial plateau here, significant splits and bits of damage in, so really nothing that the scan kind of picked up at all, but there is. Here you can see all these sort of flaps of cartilage and bits lifting off. So little split in the femur here, which was that's the edge of the split that we saw, and we're going to leave that alone just there. But actually the top of that shin bone needs a bit of trimming with the shaver, thanks. So we'll clean it up a bit as well. There's a bit of murky stuff in here, and this I think is where those little bits of cartilage have come from so far. So a little rotating blade on this shaver, and what we're going to do is just going to trim off some of those bits. A little bit of synovium there, we'll take those away. If I come in with a little shaver there, you'll see trimming off those flaps of cartilage. Interestingly, on the lateral, the outer side of the knee, not on the medial side. There we are. can see there, that's the sort of depth of cartilage, normal, that middle ridgy bit, and then just going to see if there's any more. No, I think it's probably about enough there. Take a picture of that. There we are, that's the little edgy bit there, probably go. So we'll just tidy that up a bit, take some pictures. So here we are, posterior horn of the lateral meniscus normal, anterior horn just underneath this normal. And that's this damage on the shin bone just here. Partial thickness damage, soft cartilage. You can see there these little sort of areas. Don't really want to shave any more than that. But yeah, certainly not normal. So, and the ACL normal there. The femur, that little tiny line in it, probably where it's been rubbing on that damage. But otherwise okay, and the lateral meniscus normal around there. So, lateral tibial wear. So here we are now on that bit on the back of the kneecap that we talked about. Soft cartilage here, and that should be really firm, a little bit more like this side here. And that's soft cartilage there, and you can see splits and damage in it right on the apex just here. So that is some damage. We might just trim off a little bit of that. Not too much needed, a little bit of wear there, and you can see those splits. So there certainly is some chondromalacia or soft cartilage on there. And we'll just take away those little, you can see there the little crevasses. And then the split there, so it's very similar to the end of the thigh bone on the lateral side. I'll take the shaver, thanks. And sometimes I'll shave away some of this softer cartilage. I'm just going to take away, this is about 6-7 millimeters thick, this cartilage, so we're only just taking away the unstable flap edges. So it might look like we're doing a lot, but actually we're doing very, very little. There we go. And if we take away those little crevasse edges, and this shaver really only takes damaged articular cartilage, then what we've done is hopefully made it a little tougher, and it won't click and crunch quite as much. There we go, that's probably, there we are, a little crevasse there. See that falling into one. So not too bad really, a little bit of wear and tear, a little bit of wear and tear on the lateral tibia, a little bit of wear and tear here. We'll trim and tidy that last little bit, and then I'll come and show you that with a probe. Probe, thanks. So here we go, little probe coming in, and that's these little areas here, and that's, I don't really want to take much more of that. There we've just opened up that little split there, might take a little shave in that split. So it's really soft cartilage, but I've tried to take away those rough crevasses, and that's just soft cartilage there. Don't really want to take much more of that. We'll take a little shaving just of that bit there, that little split. Shaver, thanks. Just focus that a little bit. Thanks. So here we go, last little bit, just going to shave on there.